Chastity is the Director of Patient Care and Innovation at Coal Country Community Health Center, a federally qualified health center with service delivery sites in Beulah, Hazen, Center, and Killdeer. Chastity has over 25 years of combined nursing experience in the areas of long-term care, home health and hospice, acute and primary care, population health, quality improvement, and care coordination. Also with us is Heidi Moore. She has been a public health nurse for Custer Health, located in Beulah, for the past 10 years. Prior to her role as a public health nurse, she has experience in primary care as a clinic nurse and occupational health as an industrial nurse. Neither presenter has indicated that this presentation will include any discussion of any commercial products or services and will not include any discussion of off-label or investigative usage of any products or services or trade names. Thank you both.
Okay, so we went a little bit too fast, and I don't know how to get back now. Let me try. There we go. Okay. All right, sorry everybody, a little bit of technical difficulties. It's Chastity Dolbec and Heidi Moore with us. We're going to kind of basically discuss today how we've been able to improve the health of the population we serve through community collaboration. We'd like to look at 3 learning objectives to describe how a local public health unit, critical access hospital, and an FQHC have worked together to improve the overall delivery of our healthcare systems within our medical neighborhood through completing a community health needs assessment and further implementing a community health improvement plan. We'd like to identify our key community partners that have been part of our collaborative community health improvement plan, and also describe the benefits of collaboration within our medical neighborhood in rural North Dakota. So the agenda will look at the background of what we've done, as well as our service area that we provide care to within our communities. An overview of what we've termed a patient-centered medical neighborhood, expanding off of the patient-centered medical home concept. Looking at a community health needs assessment and how we've done the process together over about the last decade. How we utilize a community health improvement plan on a monthly basis and really use it as a living, breathing document. Some collaborative initiatives that we have implemented in rural North Dakota, and that we've definitely realized some improved health outcomes for the patients that we do serve. And then how our collaboration really, we believe was able to let us respond to the pandemic together, being more resourceful with each other. And then what does the future of our medical neighborhood look like today? So this is a slide that was taken. It's an older slide, and I should point out that the gray health centers in Larimore and Grand Forks are now called Spectra Community Health Center, but it was a slide that we took from CHAD, the Community Healthcare Association of the Dakotas, and this is just kind of giving an overview of where the federally qualified health centers are located in the state of North Dakota. And this slide, taken from the Center for Rural Health, is a slide that shows all the different critical access hospitals, rural health clinics, and then where the location of the tertiary centers are in the main regions of North Dakota.
The next slide we took from the North Dakota Department of Health website, and it just kind of shows where the public health units are. So Custer Health is made up of five counties. Our main office is located in Mandan. A lot of the lines are kind of divided based on population and demographics, which works great when you're doing your day-to-day stuff. But when you find yourself in the middle of a pandemic and you're one of the smaller outlying counties, a lot of our resources are based and housed in Mandan. So then the outlying counties had to kind of find their own resources, and hence the collaboration on how to take care of our counties that we are in charge of here. The next slide just shows our community partners for our patient-centered medical neighborhood. The Secaucus Medical Center is our local hospital based out of Hazen. The Coal Country Community Health Center has clinics in Beulah, Hazen, Center, and now Killdeer. Us, for Custer Health, we're the public health unit, and we take care of Mercer and Oliver County. And then also with the Killdeer Clinic, the Southwest District Health Unit, there's public health based in Dunn County, and I believe that's based out of Dickinson. Our Knife River Care Center is our long-term care facility in Beulah, and then the Hilltop Home of Comfort is the nursing home in Killdeer. Mercer County Ambulance, Emergency Services, we have a building in Beulah and in Hazen, and then the Killdeer Ambulance is separate. NDSU Extension, and then our local school districts, which consists of Beulah, Hazen, Center, and the Killdeer school districts. So part of the collaborative relationship, I guess, is basically very strengthened with the transparency that we have between all the corporations. Just looking at the board members or the integrated governances, 2 of Coal Country board members also serve on the hospital board, and then 2 of the hospital board members serve on the Coal Country board. My former public health administrator serves on the clinic board or the Coal Country board. There's 2 nurses out of the Beulah office, and I serve on the clinic board, and the other nurse serves on the ambulance board. There's a nurse from the nursing home that serves on the Coal Country board. The former CEO of the clinic serves on the Knife River Care Center board, and then there is an RN from the clinic that serves on the ambulance board. So as you can see, we there's no hiding anything, I guess. We all have different board members integrated within the different entities. And then functionally independent, our community health needs assessment, community health improvement plan, strategic planning, services and workforce, and care coordination. So that's just kind of the documents that we work off of and try to better our community for.
So as far as the local public health unit and the FQHC collaborative model for Custer Health and Coal Country Community Health Center, we really began with our collaboration informally back in 2011 and 12 when we completed our first collaborative community health needs assessment. We then realized the success and working together. So we have completed subsequent community health needs assessments in 2016, 2019, and we just received our information for our toolkit, and we'll be starting our next community health needs assessment with all of our partners in this next year. We've really, we're lucky early on in our 2012 process, a key team member, which is now the Custer Health Administrator. She was instrumental in really helping us to develop and implement a community health improvement plan, which was based off of our community health needs assessment and those prioritized areas that we wanted to focus on. From that, we further developed goals, objectives, activities, outcome, timeline, and assigned lead organizations to take responsibility for carrying out those prioritized needs. And then in 2012, it's hard to believe we've been meeting monthly for the last 9 years, but we have a population health committee. We call it our Pop Health Committee. We meet monthly. And we utilized the community health improvement plan to really carry out the agenda of our meeting. It's based off of what we have identified as those prioritized needs, and we utilize that document on a frequent basis. The agenda is based off of exactly what those areas are, and we discuss collectively with all of our medical neighborhood partners how we're going to continue to move that bar forward in addressing the needs that were identified and reaching our goals. We have some aha moments where we celebrate our successes, and we have some let's come back together and regroup when we have some failures. But always we keep at the forefront that our goal is always to improve the health of the population that we all serve together, and that by combining our sources, our resources, our staffing, we are better doing this together than we are individually in silos. We thought we would utilize this slide to kind of show where we were at in 2016 and where we are currently with our 2019 community health needs assessment. And those prioritized areas are those top needs that were identified by our community. In 2016, one of the, I think the very important outcomes of one of the needs was not having adequate childcare services was the need. And our goal was we implemented a daycare cooperative that was basically developed, implemented, and is still very successful for us today. And really one of the big things that we had as an issue for us is whether it was our local energy industry, healthcare, school, we all were struggling with finding adequate childcare services. And so the members of the neighborhood came together along with other industries, and together they have facilitated a childcare cooperative for us. It's called the Energy Capital Childcare Cooperative. Another thing I think that I'll just point out as well is the availability of mental health services, substance use disorder, drug use and abuse is always a top need for our community. It's always on our radar, and that is something that we just don't stop trying to provide more and more resources, whether it's through our school districts, whether it is through the clinic alone, through the emergency department and crisis intervention, but it's something that we all focus our energy on together.
The priority groups that we have are, like Chas said, the mental health services, substance use and disorder services, and then our aging population services. For the mental health, we continue community education, utilizing some resources for both mental health and substance use services. We've established MIP and MIC classes for all the school districts. There's a youth nicotine and end sensation program based through the schools. And then the Mercer County Good Neighbor Project, the syringe exchange program, was about ready to start. And then we had to put that on the back burner. So I'm really hopeful that this summer that will come to Mercer County. It is active in Morton County in our Mandan office. And then just with the mental health services and just the need up in Mercer County, I think that'll be a good addition up here. And then the volunteer transportation services, that's been a challenging thing for us to get. It's just those, like getting a ride home after a colonoscopy, or say you were taken to the emergency room and you don't have family to get you home. Just the liability part. So we're still kind of working on that. But it is definitely something that we talk about every visit or every meeting, and are working on trying to get some different options for just our patients locally to have transportation services. And then the aging population services, volunteer senior companion care services. We do have a local, the Home Instead Senior Care has started some of this. They did get some grant dollars just through COVID monies. And like if you were receiving Meals on Wheels, or you had those QSP or a quality service provider through social services coming into your home and helping you with different things, you were able to get some of these services free of charge just through COVID money. So like it says, they're still in motion. It's things that we work on monthly, brainstorm about, and just try to get services available to our people in our community. Okay, next slide. Let's see, development of a comprehensive and active work plan. This is our monthly meeting, or our POP Health Committee. We have members from just the different entities, the Critical Access Hospital, or FQHC, which is the local Secaucus Medical Center, like I mentioned earlier. a long-term care facility. Knife River Care Center is the nursing home in Beulah. And public health, I'm on that committee through Custer Health out of Beulah. And then also we have a dietitian from WIC out of the Mandan office that tries to come in, and she is on what's that other, Parents Lead. She has part of that grant. So she comes and does some, or helps us brainstorm with money she has or different things she can offer through our population health. Local ambulance service, NDSU Extension Center. We did lose an agent, or she just not relocated, just took a different job. So right now we only have one extension agent in Mercer County. And he does things that we can, but obviously they were able to be a little bit more active when we had two. And then just various community organizations. We have guest speakers every once in a while that come in, kind of offer what, if they're new in the community, or they have like a little kid thing coming up, or the library lady has something to offer, they will come and visit with us to see if we can help or offer different things for them as well.
So some of the community collaborative initiatives that our medical neighborhood has undertaken that really has benefited all of our organizations. And one of them is the Dakota Nursing Program. It's a partnership with Bismarck State College where we grow our own. We're able to have individuals attend class locally through, we have a classroom at Secaucus Medical Center. It's a partnership between the hospital, the clinic, and Knife River Care Center. It's an IVN setting with clinical rotations that happen at all of the organizations. And we've really been able to realize keeping those nurses, it's difficult in rural North Dakota to find enough nursing team members, and so this was a way for us to kind of grow our own and have access to some good team members as we continue to grow and expand services in our community. Partnerships with UND School of Medicine, University of Mary, their Doctorate of Nurse Practitioner program are just a couple of examples. Other examples of academic institution collaborative relationships we currently have with social work, addiction counseling, mental health counseling, PAs, so registered nurses. That is very, very nice that you can offer rural kind of preceptorships or rotations for different healthcare fields. The Our Cool Health Scrubs camp that we have every year. We were sad we weren't able to offer that this past year because of COVID, and really looking forward to the next time we can offer again. And that is a partnership that we have with Center for Rural Health, a grant that is offered, and we're able to have some innovative ways of having exposure to 8th graders in all 4 of our school districts, and really showing them the different professions or health education or career opportunities around health. I already talked about the Energy Capital Child Care Cooperative, and we've been very, I think, lucky and blessed to be able to have accountable care organization models being developed within our community collaboration that have been successful for all of our organizations and our patients.
So with the collaborative approach to improving population health, we have different activities that we host or support or just try to hold throughout the year. One of them is the Women's World of Wellness and Mammal Marathon. The last one we have, they titled it Cinco de Mayo, and that, or Cinco de Mammal, now I said it. But anyway, it happened on May 5th, but we have representatives from Women's Way come in, the Bismarck Cancer Center, the NDSU extension agent did a thing on sun safety. The hospital's hospice was in there. Physical therapy from the local hospital came in and did like pelvic floor exercises, just different things that are based. There was a dietitian there. So we have our education section part of the Women's World of Wellness. And then towards the evening, then we had like Plunder, just different boutiques came in, different stores, they had snacks. So we just had some shopping and kind of fun things going on with that. So we try to make it a big event to obviously get women in to get their mammos yearly, and then to kind of make it fun so we can collaborate and visit and do some things as women too. Healthy happenings, just basic, I don't know, information that's put in the newspaper on sun safety or car seats or just different things that come up, both young and old, just a little article once a week in our local newspapers. Child and adolescent immunizations, projects in the schools. So I go through and I check kindergarten, 7th and 11th grade for sure, just to make sure that they're up to date on their immunizations. And then if they're not, then we, try to encourage them to go in and get their well child checks and get their immunizations caught up. The community COVID clinics, we had a variety of ways that we were able to offer the COVID vaccine. We had some troubles, which I believe we go into a little bit, but just getting the vaccine here right away, with my main base being in Mandan, I wasn't able to get a lot of doses allocated up here where Coal Country, they were able to get, it was just kind of a mess right away. So we really had to sit down and kind of sort through and what would be the best for our community. So Coal Country had their COVID clinics, and then Custer Health had our COVID clinics. We were able to offer them at different times, different locations. So we were able to kind of collaborate and get if people wanted COVID or Moderna vaccines or Pfizer vaccines in our community, they had a couple different options to get them. The North Dakota Department of Health grants, with hypertension, suicide prevention, and tobacco cessation. Colorectal screenings, we do free fit cards during March through the clinic at the primary clinic visits. And then we did do a flu fit campaign in October with Coal Country and with us. So when the people came in to do their flu shots, we would ask them about if they've had their a recent colonoscopy or if they were due to have the occult stool test. And then, like I mentioned earlier, the syringe exchange program, the Mercer County Good Neighbor Project, that is going to be implemented pretty soon. And that's more of a prevention, trying to prevent hepatitis C and HIV, the spreading of that, just through proper needle exchange, hygiene, using alcohol wipes and that kind of thing. But while you're at that, we also offer referrals for education and jobs, and if you want to quit in different ways. So it's a door of opportunity for those people to get the healthiest practice, I guess, that they can, and get off of their drug use. And then the employee health and wellness programs just are different corporations. We try to do like just wellness things that are offered as far as like healthy snacks or healthy drinks or yoga, or encourage you to go bowling, or just different things, activities outside, just different programs that you can earn points for walking and that kind of thing through our different entities. The collaboration and initiatives with population health projects, all the people that were mentioned before had an opportunity to attend an honoring choices and advanced care planning. So basically it got us all speaking the same language. So we had the same forms. Now we have the same CPR, like we have a code and a no code versus 1, 2, 3, and then do not resuscitate, or, it was just a lot of variation. So we all went on the same page and went to the same classes, and just trying to do that advanced care planning for our patients. Just kind of it helped the patients, it helped the families, and it helped us as individuals. And then the Well Child Visit collaboration. Um, Coal Country sponsors they do sports physicals on certain days, for instance, where they have hot dogs and um, oranges and apples and water, healthy drinks and stuff up there. Where I brought up like an HPV display, just encouraging kids to get the other vaccines. They're getting their meningococcal or tetanus for school, but they also can get their hepatitis A or HPV. So just trying to help with some of that education wise. Um, so kids we get everybody on the same page and get their immunizations up to date for school and beyond.
And then in addition, Coal Country, Public Health, Custer Health, the Department of Health, and Blue Cross Blue Shield, we all participated in a Well Child Visit collaborative, really focusing our efforts on getting those younger kids in for their Well Child Visit, Well Child visits. And it was a collaborative that lasted well over a year. We did a lot of joint messaging, pamphlets, flyers, things were created in really focusing efforts across the state and providing education on the importance of completing Well Child visits. And so that was another collaborative that we thought was very beneficial, trying to preventatively screen and assist kids, and then referral mechanisms on through the Department of Health and Human Services as needed. So that was something that we felt was very beneficial for our rural community. Other approaches that we've taken together, one of the very big challenges we felt early on, like Heidi said, was access to vaccine. We had a lot of patients calling and wanting, but we couldn't get our hands on vaccine, and that was a little bit of a struggle for us. In addition, early on, I shouldn't say early on, more mid-cycle of the pandemic, that October, November, December timeframe, we all were very overwhelmed and stressed with what was happening in our community with positive rates at that time. The public health nurses were doing contact tracing. Some of the clinic nurses were taking weekend call just to take care of all the positives that were coming through our hospital, and trying to make sure that contact tracing was happening at the time of diagnosis. And we really were tasked with, we're not providing the same care that we used to provide. Custer Health was unable to do some of their normal, usual daily tasks that they did with patients, and Coal Country was tasked with just acute visits with respiratory symptom or COVID symptoms. And so we reached out to our local hospital, and we were able to utilize some of our community care, visiting nurse, palliative care, hospice care nurses, and they helped us then to do some of those daily tasks or visits with some of our patients in their homes, because we were tasked with other items or other priorities that needed to be taken care of for that day. So again, that collaboration for us locally was successful in the fact that we were still able to take care of our patients. We just had to kind of reshift our gears and saying who's the best entity to provide that care on that day for the patient, and we still were able to take care of our community at large. We early on did put together, Dr. Erin Garman, our medical director at Coal Country, put together a medical neighborhood healthcare community preparedness committee, and we met frequently, sometimes multiple times a week, sometimes every 2 weeks, but we really tried to figure out how could we have community surveillance testing, how could we be screening and providing triage services the same, speaking the same language, looking at that surge capacity. If we were having to take positive COVID patients and admit them to our local critical access hospital, how did we take the hospital and keep a sick side and a clean side, having enough capacity for nursing providers and triage. And then when we got down to the vaccine and being able to provide vaccine, that is where we had some additional struggles. Coal Country Community Health Center, being a federally qualified health center, was able to be part of the HRSA vaccine, the HRSA COVID-19 vaccine program. And so we were able to supplement doses and then add additional doses of vaccine just because there was not enough to go around for our state. And so together, we definitely say that we are greater than the sum of our individual parts. One of the, I think, very interesting projects that we've taken on in this past year and previous to that is the Patient Family Advisory Council. Again, it is within in our medical neighborhood, and we really get a lot of great input from patients that may be seen by our public health unit or seen in our local emergency department, and then back in our clinics again, our local nursing homes, and just really, take that feedback wholeheartedly and try to improve the care that we are providing to patients. Something that we tried to take on and the pandemic hit was the age-friendly health system. We always say, oh, the pandemic hit, but it truly did. And so we decided together with our committee this month that we're going to try to focus our efforts on the age-friendly health system and focusing our efforts on improving medication safety, mobility, mentation, and what matters for our elderly population in the fall. We know we'll kind of have some time, or we sure hope we'll have time to really devote time and energy to really developing an age-friendly health system within our medical neighborhood. We kind of talked about some of the different things that we have done with our population, the aging population, especially when the pandemic hit hard, and how we just kind of reshifted and utilized different resources and nurses in our community to still provide care on a daily basis. And then, as Heidi had kind of already pointed out, some of those health observation celebrations that we have done and continue to do, and really we tend to have a lot of fun thinking outside the box and having fun with our community and promoting health and wellness.
Yeah, and this is just a continuation of that, the collaboration and initiative for public health projects, the Jumpstart to Wellness. We all have the fancy green shirts. And so when we wear them, if we're at the fair, at the parade, or just doing different things, people know. It's kind of our signature. I guess we talked about sports physicals, senior citizen jam sessions. The 5K walk and run has really been a family event. That's been kind of fun. And we have that. I think we've had one in Beulah Center for sure. I'm not sure if we've had one in Hazen, but just trying to get the different communities involved with that. We talked about the community or the employee health and wellness program, Kids Day or preventive wellness visits. I believe that's the day that the clinic had some bouncy houses in the back, or they're able to give out backpacks or just different incentives to get people in to take care. It just seems like once you're done with your kid shots, there's just a lapse between like 15 months until they have to go into kindergarten, and just trying to get those kids in and keep them up on their well child checks. Healthy summer picnic baskets. They had just a display down at the local grocery store. And then our Halloween bash we hold up at the Civic Center. And to be quite honest, I was a little leery when we started this because there's no candy involved. We give out like glow-in-the-dark bracelets and pretzels, and some had like yogurt with fresh fruit and string cheese that they make into mummies, and oranges, and there's crafts. We had popcorn. There's crafts and activities and healthy snacks, and it's been kind of fun. We've done like a car, and then we have display booths too. So we've done a car seat safety display booth. We had like a skeleton there and buckle bones, and I know the NDSU extension agent, she did something with toothbrushes and stuff. So the kids really enjoy it. Just with Halloween, it's also out of the elements a little bit. So the families with younger kids, they can come in and the parents can visit, and the kids can run around and get some different snacks and play some games, and just kind of a break from herding your children down the street for trick-or-treating.
So in addition to our monthly population health committee meeting, we've also realized some improved population health outcomes in gathering key members in our medical neighborhood for a care coordination committee meeting. We have business associate agreements, confidentiality agreements. And what we really try to do is bring together key members of our medical neighborhood and discuss those frequent flyers to the emergency department, patients who have a potential or they've experienced a repeat admission within 30 days. And what kind of care coordination efforts can we implement to reduce those potentially preventable emergency department visits or repeat admits to the hospital? Some of the things that we'll look at is maybe utilizing Heidi through public health to do medication setup and medication management in the home. If we need a skilled nurse visit in the home, we'll send our visiting nurse services and provide that skilled nursing care for a limited time, and then transition our patient into our community care program where we have nurses and social workers who visit patients in their homes, and they're really those eyes and those ears back to the primary care team back in the clinic. Our overall goal with this is really that quadruple aim, looking at decreasing cost, improving patient and care team satisfaction, and of course, always looking at how we can improve the health outcomes of the patients that we serve. I've listed the partners that are part of our care coordination committee. Again, we meet monthly, and we've been doing this for 5-6 years, and some of the outcomes that we've been able to realize have been a reduction in ER visits that could have been maybe held at the primary care clinic, a reduction of admissions. We've seen improved patient satisfaction because of care coordination. And then definitely we've realized some of those shared savings back within our accountable care organization models, and kind of that transition from volume to value and being reimbursed or being paid based off of outcomes for patients and not just on that single visit that happens. So weathering the storm together, we've definitely had our struggles this past year, and communication was definitely important for us. But we've come to realize that the pandemic did not break us, but basically strengthened us and continue to strengthen us. Our priorities shifted through all of it, as did everybody else across the state of North Dakota, or our nation, or our world. There were changes for Custer Health, there were changes for Coal Country, but together we realized that if we work together, we're better able and better suited to provide care to our patients. We talked about some of those frustrations or challenges that we've experienced with vaccine. We sure wish we could have done more partnering together, but Heidi and I talked earlier, and she said there were some patients that were just scared to come into the clinic because they were afraid they were going to get COVID at the clinic, because that's where the sick patients were. So Heidi having an option to have a COVID clinic, a vaccine clinic at her office was definitely a positive for us. But again, we're glad that we're here, that we're doing this together, and that we're able to weather a storm together. Had we not had the collaboration that we have had and continue to strengthen, I don't know if we would have gotten through it together as well as we did. And definitely, we do believe that communication is the key.
We did have a couple patients that, growing up, everybody got all their school shots through public health. So there was quite a few patients that they knew to call public health to get a shot, but they didn't know that the clinic gave them, so just kind of what generation you were in. It was just nice to have some options. I used PrepMod, which is the North Dakota-based registration system, where Coal Country was able to continue using their Epic for scheduling and stuff. So just different things like that we didn't have to work separately, but it was easier to work separately to get things accomplished together as a whole.
And last, we'd like to close with kind of what does our future look like? Members of our medical neighborhood, the Coal Country Community Health Center was able to write and received a HRSA network grant opportunity for developing a network. And we have since been able to complete strategic planning. We have shared mission and vision statements. We completed an environmental analysis, and we have at this point 4 different committee work plans, and it is a formal structure now. We've now named that the Energy Capital Health Network. And our goal really is to continue to strengthen our collaboration. And we've listed those goals. I know that we're running out of time, so I won't go through each of them, and they're available on our slides, but I will close with what our network statement is. And we've basically realized that the organizations working together can have a positive impact on the health outcomes of the communities in which we serve. And we feel that through deeper commitment, the network sees a future where healthier communities can be realized through collaboration and innovation between our network partners. So with that, we'll close, and if there are any questions, we are able to stay around and answer. And thank you very much for allowing us this time to share our story for rural North Dakota and how collaboration has been beneficial for the communities that we serve.